This is a paper from Spain that follows long COVID patients 2 years out from diagnosis. So, this is a 2 year prospective cohort study of long COVID patients, which included individuals that fulfilled the World Health Organization's post COVID condition definition, which is just another way to say long COVID. And the study included individuals that fully recovered clinically. Their study followed 548 individuals, where 341 had post COVID conditions, and the median follow up time was about 23 months. After a statistical cluster analysis, only 26 subjects, or about 8%, recovered from long COVID during the follow up, where subjects that were presenting with muscle pain, impaired attention, trouble breathing, tachycardia were less likely to recover from long COVID. This shows that recovery from long COVID is extremely rare during the first 2 years, posing a major challenge to healthcare systems. Where the small chance of recovering from long COVID during the first 2 years underscores that as COVID transmissions continue and few people are cured, subjects with long COVID will continue to accumulate over time, meaning that so long as COVID is unchecked, more people with long COVID will continue to develop within the coming years. So again, this observational cohort study was performed in Spain. The study happened between May 1st, 2020 and February 17th of 2022. The acute COVID infection was confirmed by one of three ways, either by PCR, by rapid antigen test, or by serology testing. And vaccination status was also considered in this study, where long COVID patients were asked if vaccination improved or worsened their condition within 1 month after vaccination. Subjects in the study were visited at months 3, 6, 12, 18, and 24 from the date of their acute COVID diagnosis. And the educational level of study was categorized into 4 groups: less than basic education, primary education, secondary education, and tertiary education or higher, where they used structured questionnaires to ask about the symptoms. And a patient was considered recovered from long COVID when all persistent symptoms remitted for at least 3 consecutive months. Or alternatively, subjects with symptoms before their long COVID diagnosis were considered recovered when they returned to baseline status prior to their COVID infection. In the study, there were 548 participants, 341 with long COVID and 207 without long COVID, where the majority of acute COVID infections had been mild. Only 130 subjects were hospitalized during acute COVID and only 16 required intensive care. And from this analysis, the most frequent presenting symptoms in subjects later developing long COVID were fatigue, trouble breathing, neurocognitive complaints, headache, arthralgia, cough, diarrhea, chest pain, low-grade fever, myalgia, so the tiredness, fever, smell alterations, tachycardia, and hair loss. So if you experience these types of symptoms during your acute COVID infection while you're having active COVID, then you're more likely to develop long COVID with a greater than 50% frequency. Where the most frequent persistent symptoms in subjects with long COVID were fatigue, joint and muscle pain, trouble breathing, headache, neurocognitive complaints, cough, chest pain, tachycardia, and diarrhea. And while these were the most frequent, there were also a plethora of other COVID symptoms that were associated with an increased risk of long COVID. These included dysphonia or hoarseness, tinnitus, that ringing in the ears, visual alterations, insomnia, so the trouble sleeping, neurocognitive complaints, neurosensitive alterations, mucosal dryness, tachycardia, dizziness, and abdominal and chest pain. Where again, only 26 of the study participants were considered recovered from long COVID during follow up after 2 years, where the median time to recovery was almost 1 year. In terms of vaccination and long COVID, it didn't seem to have a positive or negative effect on symptoms. So people with long COVID from this analysis should still continue getting vaccinated, which then brings us to our prior stated conundrum that as long COVID transmission continues and few people are cured from long COVID, subjects with such disabling post-viral syndrome will continue to accumulate and will have to be properly absorbed and managed by a currently unprepared system, meaning that we know the number of people with long COVID is going to continue to increase over time as COVID infections continue, and our hospital system is not set up to absorb this major influx of chronically disabled individuals.